Hello everybody, welcome to my channel. This is Dr. Julius Kwedi. I'm here presenting a case of 70-something-year-old female who presented to the hospital with a history of Ischaemia claudication. History of claudication on the left as well as on the right. The patient could walk but had very painful legs. It's not Ischaemia, acute limb ischemia. It's chronic limb ischemia from atherosclerotic disease of the blood vessels of the aorta and lower limbs. And so patient is presented with pulselessness on the legs, on both legs, especially in the inguinal area, the femoral region, presented with thigh pain and pain in the muscles of the lower leg, and we did a CT scan. We also did ultrasound, and this was the result of the CT scan. Now, as we can see, this patient had endoprosthesis of the left hip joint replacement. He had a hip replacement on the left as well as on the right. All right, so you can see the titanic metals. But now our concern is the blood vessels. We are looking at here. We're looking at the common femoral artery on the left as well as on the right. Our setting is on bone setting, which allows us to see the blood vessels contrasted, and we can see here the calcific changes in the left common femoral artery. You can see the calcific changes in the common femoral artery here, and we can also see that the common femoral artery is occluded. The same to the right common femoral artery. It is also occluded, right? And when we follow that down, we can see that they're still occluded. The left and the right common femoral arteries, and then as you can see, this one is the femoral veins, right, running parallel to the common femoral arteries. All right, and as you can see, still so you can see that the common femoral arteries and the superficial femoral arteries are all blocked. We can also see that at the bifurcation here, see that? At the bifurcation here, at the bifurcation of the common femoral artery into the superficial femoral artery as well as the deep femoral artery, the bifurcation, both the superficial and the deep femoral arteries are occluded, right? As it is on the left, so it is on the right, right? But you can see that the patient has, you can see here that the patient has collateralization, has collaterals that have formed here, as you can see here on the right side here. Well, the collaterals have also formed on the right, on the left, which is a characteristic feature of chronic limb ischemia. Our patient does not have wounds on the extremities, on the lower extremities. Therefore, putting together the pain at rest, with calcific changes or with atherosclerotic changes of the arteries of the lower limbs, we can safely say that this patient has stage 3 of chronic limb-threatening ischemia. According to Pokrovsky. In Russia, we use the Pokrovsky classification. We use the Pokrovsky. Pokrovsky was a Russian vascular surgeon who described the stages of chronic limb ischemia. In the US, in the West, they use mainly the Rutherford classification. But here we use the Fontaine-Pokrovsky classification, where you have stage 0. Let's say stage 1. Stage 1, you have atherosclerotic changes, occlusion, or stenosis, asymptomatic occlusion or stenosis of the lower limbs, arteries. Then you have stage 2, where it's now symptomatic atherosclerotic disease. And stage 2 is divided into 2A as well as 2B. 2A is when the patient can walk for more than 200 meters without pain. So the distance of pain-free walking is more than 200 meters. And then stage 2B, the distance of pain-free walking is less than 200 meters. And then we go on to stage 3, where the patient has pain at rest or pain upon minimal physical activity, like two steps or 50 meters. I think our cutoff here is around 50 meters. The patient can walk 50 meters without pain, and then pain begins, or 40 meters without pain. Or should I say less than 40 meters, less than 50 meters without pain, then we also classify that as stage 3. And then stage 4, obviously, is now when the patient has trophic changes of the lower limbs, has trophic changes. All right, and our patient here has no trophic changes, simply atherosclerotic changes, symptomatic occlusion of the common femoral, superficial femoral, and as you will see, as you can see here, the superficial femoral is clogged. The superficial femoral here is also occluded, both on the left as well as on the right. Now, of course, the right has some collateralization that feed into the superficial femoral artery. However, both legs are in pain. Now, when we continue down to the knee, we find that even the popliteal artery is also occluded, right? As you can see here, you can also see here that the popliteal arteries are also occluded. You can see there on the right as well as on the left, right? And you can also see some the changes or the differences in the size of the lower limbs. All right. And then you can see here that it's contrasting the superficial femoral artery down toward in the lower third of the thigh is contrasting, but with intermittent occlusions there. But on the left, it's totally and absolutely occluded, right? And then here you can see some contrasting begin to show up. Now, and then we continue. All right, you can see here, this is now infrapopliteal, and this is now infrapopliteal. As you can see, the occlusion on the left, and then on the right here you have significant stenosis, hemodynamically significant stenosis, but there's also occlusion, you see. And there's also occlusion. There you go. There you can see here. This is good. You could call it subocclusion, but and then it opens up. But on the left, it remains totally closed. And then on the right, you can see here that the calcific changes or the occlusive changes continue. Steno-occlusive changes continue, and then here, as you go to the bifurcation of the popliteal artery into the anterior tibial artery and the tibial peroneal trunk, you can see that they are open here. You can see that the tibial peroneal trunk and the anterior tibial arteries are open, and then the tibial peroneal trunk gives off the peroneal artery as well as this posterior tibial artery. There are also steno-occlusive changes, but then going down here, you see the anterior and the peroneal arteries are both open, but then no sooner that you see the peroneal artery gives off here a collateral, because immediately below this collateralization, below this collateral formation, you have occlusion, right? And this is the typical behavior of occlusive changes in the lower limbs, that prior to the occlusion, you always find that the artery gives off collateral. The artery normally gives off a collateral, and sometimes 2 or 3 collaterals. I find it quite fascinating when I meet those changes. And you can see on the right also the tibioperoneal trunk. You can see here the popliteal artery here eventually gives off the anterior, and as well as the tibioperoneal trunk. The anterior remains open for some time before it's steno-occluded here, and then you can see the tibioperoneal trunk here also gives off a branch, collateral, and then the tibioperoneal trunk here also gives off the peroneal as well as the posterior tibial artery. And as you go down, you can see here that on the left, eventually the anterior tibial artery is occluded, leaving the peroneal as well as the posterior tibial arteries open just about, and you can also see on the right that the anterior tibial artery here also gets occluded. As you continue down, the posterior tibial artery as well as the peroneal remain open, but then they also eventually keep giving off some branches here and there. And you can see here the posterior tibial artery is occluded and the peroneal artery remains alone, feeding this limb. And you can see that and as we continue down, so now you can see that only the peroneal artery continues feeding this limb, whereas on the left, the posterior also is finally occluded, leaving us with the anterior and the peroneal artery, and then we continue all the way down the lower limbs, all the way down. All right, and continue. On the left, you can see that now you have you now have a collateral that feeds into the posterior, and then while the anterior and the peroneal arteries remain also patent there. On the right side, you can see the peroneal artery continues unoccluded, whereas the anterior also regains some collateral contrasting here. And the posterior tibial here keeps receiving and going off, as well as here on the right, the posterior tibial also keeps receiving some collateral contrast. And we are now going all the way to the ankle. We have now reached the level of the ankle, where you have all the three arteries here intact, and on the left, you are only left with the the peroneal. The peroneal goes on, and the anterior also goes on intact. All right, and here you have the posterior tibial on the right, as well as the anterior here and the peroneal. So this is the wonderful, curious case of chronic limb ischemia, and how it presents on CT scan. Presents on the CT scan. Right, so the patient was discharged home, given that we are approaching the end of the year, in order to allow the patient, to be well prepared for surgery, because this is going to be a very, very critical case, to revascularize both the left and the right. The patient has been discharged home without any surgical manipulation. Right, that's it for now. Have a blessed day, and see you in the next video.